Hey, I'm Dr. Jarret. I'm your board certified pediatrician and career restart and refresh coach who helps physicians and other healthcare professionals who are disenfranchised, disengaged, or disgruntled with healthcare restart and refresh their career. I do this through my books, my one-on-one coaching program, and other programs I have forthcoming to you. So if you feel in need of my services, go to drjarret.com, spell out doctor, J-A, two R's, E, one T, and go to my coaching page and sign up for a free 30-minute strategy session. We'll see what kind of plan we can develop for you. Suicides happen all too often in healthcare. In fact, with physicians, there's over 400 suicides every single year. Nurses, dentists, even veterinarians don't far fall behind. Much research has been done on this topic, and people don't really know what the cause could be. Could it be because we're so busy helping others we can't help ourselves? Could it be that our jobs are so stressful? Could it be that we just feel like we may be ostracized or penalized if we don't get help? It could be any number of these things, and as a result, we're left with a very high suicide rate. If you've been in healthcare for long enough, you probably know someone that's committed suicide or attempted suicide, and that's a serious issue. So there are things that you can do to help. One, you can just reach out to your colleagues and just say, "Are you okay?" and be genuine about it and really look out for their safety. You may also find out that there are other signs or symptoms that people may be depressed or having some emotional or behavioral health issues. This could include irritability, decreased job performance. They could be coming late more often or not performing up to their safety and quality standards. They could simply be very irritable and having a large swing of mood changes all the time around you. Or you may notice that they're using alcohol or perhaps even other substances in an attempt to self-medicate because they feel like they may be ostracized or penalized for seeking professional help. If you or someone you know fall in any of those categories, get the professional help. It's too easy to fall into that position or title that if something happens to your title as a physician or a nurse or as a nurse practitioner, that you feel like your whole identity and your whole life has been taken away from you. No, that's not the case. You have to take care of yourself before you can take care of others. So that being said, make sure you're looking out for your colleagues. The holidays can be very stressful for a number of reasons, and the stress doesn't stop when we're going into our job, taking care of many busy people on a daily basis. So make sure you're taking care of each other and looking out for each other as well, because suicides, again, they're happening far too often in healthcare, and it's really across all the clinical professions, particularly, always rank in the highest suicide rate above the general public. So look out for each other, especially during this holiday season when things can be so stressful for people. Thank you guys for tuning in. Make sure that you go to drjarret.com if you feel that you need my services. I am Dr. Jarret. I'm your board certified pediatrician. I am here to help professionals that are disgruntled, disenfranchised, or disengaged with healthcare refresh and restart their career. And I do this through my books, my one-on-one coaching program, and other programs I'll have forthcoming for you. So make sure you go to drjarret.com, spell out doctor, J-A, two R's, E, one T. Go to my coaching page and sign up for a free 30-minute strategy session. I'm more than willing to help you figure out what's the next step in your career. Thank you, and to all, happy holidays.